Well, now, the number of people in intensive care with confirmed or suspected flu in England has risen to 460, more than double what it was a week ago. Most of the people affected are between 16 and 64. The government has denied that its decision not to run a vaccine advertising campaign could be a factor. Our science correspondent Julian Rush joins us now. Julian, well, how significant is this doubling of those in hospital with flu?
It is significant, but not because of the headline figure. That's in line with a fairly standard conventional flu season. It's what they show about how H1N1, swine flu, is distorting that conventional flu season that's interesting. And to see that, you have to look behind those headline figures. So we have this figure of 460 for the number of people in critical care beds. That's just in England. There's a few more in Scotland as well, though not that many. That's only 13% or so of the number of critical care beds. But it's when you look behind that headline figure that you see the true story. And you see, when you look at it by the age distribution, that the people who are being affected aren't the people you would normally think would be flu victims, the very young or the very old. It's that bulge in the middle of people between 16 to 64, that 366. And it is those relatively young people who are the victims of H1N1, particularly the vulnerable amongst them, many of whom have not been vaccinated, only 43%, 5% down on this time last year, and that's causing concern to the authorities. So those numbers could still get quite a lot bigger. And the Health Secretary, Andrew Lansley, does admit that it's beginning to put some pressure on the NHS.
That is a pressure. It's quite a serious pressure, and that's quite a large number of critical care beds. But we do have the capacity to meet that. That's about 1 in 7 of the total of critical care beds across the country. So we can manage this. We're working with the NHS right across the country to make sure that where those pressures come on, we are escalating the availability of critical care capacity. Overall, bed occupancy in the NHS is at 92%, which actually is less than often we reach during the winter. So if necessary, we will take steps to ensure that we do have critical care capacity to support this.
Well, how does Mr Lansley defend the coalition's decision to cut the advertising budget that would have promoted vaccination? And well, doctors on this programme yesterday said they wish they'd had it.
Indeed they did. He says he doesn't think it would have made any difference. As far as the Department of Health was concerned, it was down to GPs to telephone those people at risk, particularly the pregnant women who are for the first time amongst the vulnerable group in that 16 to 64 age group. And they've done so, but only at the relatively last minute, and it's only now that we're beginning to catch up.
Well, Julian, thank you very much.